From high atop Healthcare Hill in Central Maryland, this is BSN Headline News. Today's top story is May 6th through May 12th is National Nurses Week. National Nurses Week is celebrated every year starting on National Nurses Day, May 6th, and concluding on Florence Nightingale's birthday, May 12th. Now, we've been running stories the entire month of April about nursing and Nurses Week. Today, we're going to let Bon Secours' chief nurse do all the talking. Here's Andrea Mazzocolli, Chief Nursing Officer at Bon Secours Health System.
I'm Andrea Mazzocolli, the Chief Nurse for Bon Secours Health System. So the theme for Nurses Week this year is about quality and innovation. It's about nurses delivering quality outcomes and innovating a new way to take care of patients. I think quality and innovation were at the root of what Florence Nightingale built professional nursing and modern nursing about. She didn't take status quo, but she stayed committed to the roots around infection control, about eliminating infections, some of the same things that nurses think about and impact today, as well as changing the way in which at that time hospitals operated. And our nurses today are changing the way care is delivered. It's exciting to take time, and that's what Nurses Week allows us to do, to reflect about our vision and about the work that we take for granted every day. When we think about the accomplishments of our health system, magnet recognition, pathways to excellence designation, top 100 hospitals, patient-centered medical home designation, ACO, every one of those things that happen in our system speak to our vision, and they happen because of what nurses are doing in our system every day. Being part of a system like Bon Secours affords our patients and our nurses lots of opportunity. When we think about a community of practice, we think about a community practice that extends from New York to Florida. We think about emergency department nurses that have access to the leading evidence across 17 emergency departments. So the richness in being part of a community, we have a college of nursing that allows us to continue advance and develop professionally to help create the next generation of nurses. So my sense is that our strength about who we are is felt locally. The impact that nurses have every day happens between that human encounter between a nurse and a patient. But the strength that we have comes from us being part of a larger community. It's about us being part of a Bon Secours community of nursing. Quality and innovation are part of our values, as is compassion. And in my mind, that is really what Nurses Week this year is all about quality and innovation that is occurring in every way that we take care of patients, innovating and changing, and most importantly, embracing the change. And I think innovation is about really understanding that it comes from the bedside and it comes from inside each of the nurse who's willing to say there's a better way to do this. At the heart, it's about being good help.
Being good help, providing that extraordinary care, transforming our health delivery are all part of what nurses do every day. Please join us this week, National Nurses Week, in saluting nurses everywhere. And if you can, this week, seek out your favorite nurse and thank them for their leadership in moving quality and innovation in patient care forward and for being good help to those in need. In other news, it's here, the Bon Secours Employee Engagement Survey. By now, you should have received your help sheet at home from Gallup. If not, please contact your local Human Resources representative or call 1-866-888-6987. We'll leave that number up on the screen for a while. Anyway, the Bon Secours Employee Engagement Survey is designed to make Bon Secours a better place to work. But how does it work? Good question, and here's the skinny. It really starts with you answering the survey, and that is just 3 easy steps. First, call 1-866-888-6987 and complete the survey. Now, the questions are on the back of your help sheet, so you have time to think about them before you call. There are no hidden questions. Step 2, Enter your access code from your help sheet. Again, if you haven't received your help sheet, call the number on the screen. Step 3, answer the questions. All the questions are completely confidential, so answer them honestly and openly. Now, that's your part. From there, Gallup takes all the survey results, then identifies where we perform well and where we need improvement. From there, teams across the system work together to try to make Bon Secours a better place to work. But it all begins with you taking that survey. So let's hear from you. Take the survey and make your voice heard. Hey, it only takes about 5 minutes. The Bon Secours Employee Engagement Survey. With your good help, we can all make Bon Secours a better place to work. Finally, Pathway to Excellence. In October 2012, BSN Headline News brought you the story of Bon Secours Mary Immaculate Hospital's journey to the Pathway to Excellence designation. Today, we revisit that journey and some special recognition Mary Immaculate Hospital has achieved. To help us out, we sat down with the Chief Nursing Officer at Mary Immaculate Hospital, Jeff Doucette, to talk a little bit about Pathway to Excellence.
My name is Jeff Doucette, and I'm the Chief Nursing Officer, Vice President of Patient Care at Bon Secours Mary Immaculate Hospital in Newport News. So this is the National Pathway to Excellence Convention, sponsored by the American Nurses Credentialing Center, and Mary Immaculate Hospital staff, 50 people from Bon Secours, Hampton Roads and Bon Secours, Virginia, are here to celebrate our designation as a Pathway to Excellence facility. Mary Immaculate Hospital has been on a journey to nursing excellence, as we refer to it, for really the past 4 or 5 years. And it really starts with a core foundation of shared governance where nurses are really involved in their practice. It's really a kind of the icing on the cake, if you will, of years of work around improving the nursing culture at Mary Immaculate. I think that the key messages that I want to deliver are that really this is all about our nursing staff and the great work that they've been doing over years. It isn't just about a one-time snapshot in time award. We also had to talk about our great CEO and our great support from leadership and our board. And then again, I think that the fact that this is all, it's a journey. You know, we're not finished at this point. We're beginning to work now on our magnet documents and things like that. So it's an ongoing evolution of this culture of excellence that we're trying to create. So I think where nursing is headed is really more to population health management. And it isn't going to be so much about a single patient encounter. It's going to be developing a relationship with patients over a period of time. And the most important piece in the whole puzzle of where nursing is headed is going to be how we transition patients from one phase of care to the next, and how nursing works together to ensure that that continuity exists. And never has that been more important as it is today.
Why?
Well, I think that the care is becoming much more complex, and as healthcare reform and accountable care organizations are coming into play more and more every day, managing that patient over the continuum is critically important for our reimbursement, for our quality metrics, our publicly reported data, and all is part of our overall mission to be good help to those in need.
Indeed. Well, that's it for this week. Stay tuned to this portal for future up-to-the-minute information on these and other stories on BSN Headline News. I'm Dave Schlachter. Thanks for joining us. BSN Headline News is a production of Bon Secours Productions and is solely responsible for its content.